Welcome to The Explainer. Today, we're looking at a totally fascinating dynamic that kicks in when the world literally turns upside down. When a massive crisis hits. Maybe it's a global pandemic, a sudden natural disaster, or even a severe economic shock. We naturally look upward, right? We look to large institutions, massive government bodies, and top-down structures to, well, save us. But what if the true engine of survival isn't up at the top, but actually right next door? Today, we're going to explore how everyday people, using grassroots health systems, are the ones who actually drive massive, systemic impact during our darkest hours.
Which brings us to this really fundamental question. And I want you to honestly think about this for a second. Is the community truly capable of doing the job? I mean, when the chips are down, when logistics completely fail, and the system is just overwhelmed, can ordinary people, organized right at the neighborhood level, actually manage complex public health and crisis responses? It's a question critics bring up all the time. They kind of just assume that without strict top-down control, everything's going to fall apart. But does it?
Section 1. The Marcenes Health Framework, Rethinking Crisis Resilience. And spoiler alert, the evidence from global crises actually gives us a resounding yes to that opening question.
Okay, let's dive into this. To really understand how this works, we have to look at the Marcenes Health Capital conceptual framework. And this requires a massive theoretical shift. This framework posits that sustainable public health and true crisis resilience doesn't actually originate from top-down mandates. Instead, it comes from the organic integration of the community itself. Basically, when a health strategy is anchored in autonomy, belonging, and pro-social love, people naturally achieve high intentionality. They voluntarily comply with actions that protect collective health. Why? Because they genuinely care about each other. It's not about being forced to do something, it's about choosing to do it for the people you actually share your life with.
Section 2. COVID-19, Solidarity in Action, a real-world test. Let's look at how a recent global event put this very theory to the test. Now, a theory is just a theory until it's tested, right? And the COVID-19 pandemic gave us the ultimate real-world stress test. The source material shows a pretty stark contrast here. On one hand, heavy-handed, authoritarian restrictions and top-down mandates frequently triggered a lot of friction, deep skepticism, and massive enforcement challenges. It was a real administrative struggle. But on the flip side, when communities were driven by grassroots solidarity, by that pro-social love and local mutual aid, they achieved way more effective compliance and, crucially, emotional resilience. They managed to protect collective health, not through coercion, but through genuine connection.
Now, what's really interesting about this slide is how everyday citizens didn't just sit around waiting for a bureaucratic green light. Their actions were completely spontaneous. People set up mutual aid networks to deliver groceries to the elderly. They literally sat at their kitchen tables sewing homemade masks to hand out. They mapped out plans and translated confusing health guidelines into locally tailored information that actually made sense for their specific neighborhoods. And they pulled all of this off long before massive government programs were even able to reach their streets.
And it went beyond just immediate physical supplies. The framework highlights how grassroots groups handled much deeper medical interventions, like building vaccine confidence. Instead of relying on administrative coercion or blanket demands, these local organizations partnered with the folks their communities already trusted. Faith-based groups, local elders, community leaders. They achieved health compliance by actively listening to and actually addressing local concerns. They used empathy and a shared identity to guide their neighbors. It's a really powerful testament to the fact that people are way more receptive to guidance when it comes from a trusted, familiar face rather than a distant authority figure. Section 3. First Responders in Disasters. Local Survival Strategies. Let's move to and see how this builds when we shift from prolonged pandemics to sudden tragedies like earthquakes and floods. When we step back and compare the bureaucratic realities with local population action during sudden, catastrophic events, the contrast in response time is pretty staggering. Whether it's an earthquake, a flood, or a major supply chain breakdown, official aid packages are frequently delayed by red tape and political maneuvering. The machinery of large institutions is just fundamentally slow. But in those exact same crises, the local response is practically instant. While official channels are still waiting for administrative approvals, the local population is already out there executing immediate rescue operations and sharing resources.
Let's ground this abstract theory in some visceral human action. When a seismic event literally shakes a region, or severe flooding washes away the roads, it's the neighbors who are almost always the first responders. They're the ones physically digging survivors out of the rubble. They're the ones immediately pooling whatever food supplies they have left. And the financial response? Donations from everyday citizens flow instantly and directly to those in need, completely bypassing the slow administrative approvals required by larger bodies. The community essentially just becomes its own rapid response emergency service.
And this extends way beyond immediate physical danger. During supply chain breakdowns or severe economic hardships, communities leverage their existing social capital. They establish communal kitchens. They actively identify and safeguard the most vulnerable members of their neighborhood. And they do all of this purely through voluntary solidarity and fraternity. No one is legally forcing them to share their limited resources. They do it because their own survival strategy is inherently tied to the survival of the people around them.
Section 4, the Zero-Cost Survival Strategy, Universal Takeaways. We're going to bring all these observations together now to reveal a pretty surprising truth about health strategies. So the crucial point is that the Marcenes Health Capital framework comes down to 3 enduring universal truths. First, human connection, empathy, and pro-social love drive far higher compliance and protective behaviors than bureaucratic enforcement ever could. Second, combining individual agency with community empowerment, that crucial autonomy, is what unlocks local problem-solving capacity, and it consistently outperforms slow-moving administrative systems. And third, true well-being, resilience, and the enjoyment of life absolutely require community intention, mutual respect, and a shared purpose.
And here is the truly shocking twist of this entire explainer. What does it cost to implement this incredibly effective, globally proven health and survival strategy? $0. The Marcenes framework demonstrates that this level of crisis resilience and social cohesion absolutely does not require some massive financial investment. It is universally applicable to all communities, regardless of their economic status, at absolutely zero financial cost. It relies entirely on the social capital we already naturally possess as human beings.
Which leaves us with this final provocative thought to reflect on. We know the power is out there. We've seen it in earthquakes, in floods, and in global pandemics. But looking specifically at your own neighborhood, your own street, your own social circles, does your community actually have the health capital to survive the next crisis? Have you built the pro-social love, the autonomy, and the shared purpose required to be your own first responders? It's a huge question, and understanding exactly how grassroots health systems work is the very first step in making sure the answer is a resounding yes. Thanks so much for joining me for this explainer.